one of the challenges in AI, and particularly with images, as the technology improves and changes, those older machine learning algorithms don't work anymore. They were trained on a specific type of image. And so now as the camera technology, and we're using more advanced camera technology, we need to train new machine learning algorithms. So we've done a lot of early good testing with those. We, as part of this program, we have access to a lot of images to be able to train the system. So that it is awesome that we can make a difference there in the lives of a lot of people here in the States.
RJ, thank you so much for hopping on the podcast today. I'm excited to speak to you today, learn a little bit about your work at Estenda. And to get things started, I know you've spent over 2 decades of your own career at this intersection of healthcare and technology. Can you start by filling us in on what led you to co-found Estenda and what keeps the work meaningful for you today?
Yeah. Bert, thank you for having me today. Looking forward to the conversation. It's always interesting. I find that I've been doing this for 2 decades now. Co-founder of a company called Estenda Solutions. We've been around for 22 years now, which is always interesting to say. I got into it because I love solving problems. That's really what drove me into computer science first as a college degree, and then got into the world of consulting and worked through various different industries. It's about solving problems that I find interesting. Healthcare, medicine, MedTech field, they're sort of the last industry to embrace the idea of data. There's a lot of technology in healthcare. Think of your MRIs, your X-rays, but data is relatively new to the industry. It's coming along strong. And so part of that focus was one, solving problems, but thinking about how I want to leave a legacy as I move through this world, and very much passionate about trying to help other people. I'm not a doctor. I don't play one on TV. And, you think about a doctor and they do great things individually.
Yeah.
And as I help other companies develop their systems that they put out into the world, or if I'm working with a doctor or a PhD researcher, we're developing systems that can impact large populations of people. Some of our clients are global with millions of users. So it's fascinating to be able to go to sleep at night knowing, okay, yeah, we're making a difference in our own small little way, which is really the foundation of Estenda and everything that we're doing. Very much focused on healthcare and helping people.
Yeah. Right on. And I know, and by the way, I love the personal, mission that you lead. I think I can relate to you a lot on that, there's a lot of work to be done in the global healthcare system, that physicians are a key part of it, but there's other moving parts, people like you and I, that they need to move the ball forward and move the needle now. And to break it down further, from what I understand, you've worked with all types of global companies, from MedTech to even federal agencies. Can you give us some examples of systems that you've helped develop for large populations of people? Any stories come to mind?
Yeah, we actually got our start, interestingly, with a congressional grant for the development of a diabetes disease management solution for military healthcare. Mm-hmm. So Drew Lewis, my co-founder, good friend, started Estenda together. He had these relationships with the Joslin Diabetes Center up in Boston, a premier academic medical center focused on diabetes care. And we worked with Walter Reed Army Medical Center, the Boston VA, the Indian Health Services, along with a number of commercial institutions, community health centers, to develop this solution starting in the early 2000s, which is fascinating because as I talk about data and understanding it in those early days, it was challenging to get data. And a lot of the problem solving was, how do you deal with, the lack of data, the lack of information? And we were fortunate because working with military healthcare, with government agencies, they did, even in those early days, had electronic medical record systems, where now they're pretty ubiquitous. Everybody has them. Back then, it wasn't as widespread, but it was always interesting because Back then it was data integration, EMR integration was, hey, here's our database. Have fun. Go find the data, which was always interesting.
Yeah. And I want to dive into data because I know that's a big part of the work you guys do. Like, what are, I don't want to call them problems, some of the challenges you're seeing across like healthcare and global healthcare and life sciences when it comes to like you just talked about, like capturing the data, but organizing it and making sense of it.
Yeah. So two things come to mind. One, still to this day, dealing with unstructured data. How do you capture this information and make use of it? One of the projects, probably going back, 10 years now or so, we were extracting medication prescription data from an electronic medical record system. And we're trying to understand what, in terms of a prescription, how many tablets was a person actually taking, kind of thing. We were looking at the medication SIG, the instructions for taking that medication. Like, for example, take a tablet by mouth, twice a day.
Right.
Very common thing. But that data wasn't structured. And we started digging into the data, and very quickly we were like 20,000 different unique signatures of how to take different medications, kind of thing. So it became a very interesting challenge to try and parse that out. And we use some natural language processing to make, best guesses that, and then let a human adjudicate those decisions. So we knew we had adequate information. But I think beyond that unstructured data, I think a lot of people will be interested. It's still today integrating systems, electronic medical record systems. It's not really a technical problem anymore. There are definite ways of doing it. HL7 messaging, FHIR protocols, FHIR, which is an API-based way of accessing that data. They exist. They're out there. But it's a people process problem. If you go into a new institution, new healthcare system, and you want to integrate your application with their system, it's often a paperwork problem, a process problem or challenge that could take 6 months and 9 months to be able to access that data. And then, okay, yes, FHIR is a standard, but how is it actually implemented?
Yeah.
It's like there's sort of a running joke. Once you've seen one implementation, you've seen one implementation.
Yeah.
There's a lot of variety there. So yeah, they're the two big problems really around just capturing and organizing, making sense of this data still today, which is a challenge.
Yeah, I think we can geek out on HL7 FHIR for a second. I mean, how many people are even skilled in that? That's like it's still like, you're a data person, you understand it, but like there's still not as many skilled basically team members out there that are skilled in how to set up integration and HL7 messaging, or how to follow the latest FHIR standards, and then there's accelerators on top of that, right, for different things, and it's a whole world in its own, so
it definitely is. And I think the one advantage to FHIR, which when it came around and it's starting to be adopted more and more, there are more people in the world that understand how APIs work than messaging work today. So that's been an advantage as we've hired people and they might not be familiar with the industry, and we need to train them and educate them on how different things work. Yeah. They understand APIs. They understand the basics. They can read what they and understand what they need to much more easily than they could the old HL7 messages kind of thing. What's interesting and challenging today, we're really just starting to embrace the idea of FHIR, and along comes good old AI, and there's this model context protocol now, which is, think of, for the web, you have HTTP. That's how you communicate.
Yeah.
The MCP, model context protocol, is now how you're going to enable AI agents to be able to access information. It's now yet another protocol on top of everything you're doing. So it's just going to get more and more interesting as we move forward here.
Are you saying FHIR itself is going to have these or is that part of their scope soon, is going to be MCP, or they already are you already working on projects that deal with both? That's the
MCP is really new. I think it was Anthropic that established this protocol, made it open source, and I know OpenAI, which is ChatGPT, said they were going to adopt it too, because you need that standard protocol for communicating across platforms and systems. Microsoft said they're going to adopt this as well and even build it into your Windows platform. So it is definitely a growing standard out there. And yeah, there's going to be interplay between the FHIR and the MCP protocols in terms of getting data.
Yeah, there's a lot of healthcare organizations out there that I know of that are Microsoft users, and have are following some type of FHIR standard or protocol, in an area. I know it really depends on what you're trying to do with FHIR, whether it's like you're tackling patient access and scheduling, or you're tackling completely different arena, so yeah. And so you at Estenda, you have like this unique model where you guys help like R&D teams, product leaders, like take their digital health ideas to market, right? Like what does that process look like, and what kinds of organizations are a strong fit?
It's a good question. It starts with our software development process. We are ISO 13485 certified. If you're not familiar with that, simply means we have a good, well-documented process of how we do software development. A very template-driven, process-driven, checklist-driven. As you do unit testing, as you're creating your requirements, we have templates to really help make sure that you remember all of the things that you need to do and remember. And from a scope perspective, particularly early on, because we do deal with a lot of R&D projects, that's where we, as an organization, we really thrive and love to help out other companies create their products. You often don't know exactly what you want. You have a good idea of that. So being able to, look at checklists and work off these checklists and say, okay, we're going to consider performance and scalability, or we're not going to consider performance and scalability at this early stage, but you've thought about it. You've made that conscious decision now to say, yes, we're going to work on this and focus on that now as part of the project or later. But I think some of the things that makes it unique beyond that is one, what I said, sort of as that corporate mission, is focusing on helping others. That's embedded in our process. So as you are doing unit tests and code reviews and thinking about how you structure your code, we really push the idea of how are you helping others? You're not developing this for yourself for the most part. If we're developing a system to help somebody with mental depression or multiple sclerosis, not every developer and every person has these, but we do provide some basic medical training grounding so that you can have a better understanding of the condition to make better decisions. Yeah. But even as you're writing code, it's like you read code more than you write it. So as you're writing that code, how do you keep it simple, easy to understand, such that when you go back yourself and look at it in 3 months, 6 months, that it still makes sense? How can you, structure that so it's easier to test it, easier for the end user to use that? In part of this R&D world, because it is very experimental, we focus on building value fast, reducing risk every step of the way. That ISO process, that there is a risk planning aspect to that. And part of that, both of those of building value quickly and reducing risk, is identifying unknown unknowns. What haven't you even considered yet or thought about? And so in some instances, we're helping companies with a new medical device, which might be measuring a new value. It's like, okay, what does this even mean? What do we even do with this information? And I like to structure projects in the idea of, I use an analogy of building a car. You have a problem of you live on one side of town and you need to get to the other side of town quickly. Walking just takes you a really long time. You're like, I'm going to build me a car. Well, that's going to take you a long time. You need to learn a lot about building that car. So let's start with like a skateboard. We can build a skateboard really quickly, really easily, and get across town a little faster. We're adding value. But then, okay, this isn't the most stable thing. So let's add handlebars to it, and now you have more of a scooter. Then you can add an engine. And along the way, you're adding value, you're discovering some of those unknown things that helps reduce risk. So it's really fascinating to approach projects in that way.
That's a good analogy. Basically, you guys are the ones getting the tough product ideas and problems to solve and helping companies take those to market, Yeah.
Yeah. They often need to go to clinical trial. So, to make sure that they work is one thing. If myself or a doctor or a PhD is like, hey, here's this great idea, you really need to test that out. Does it actually work? So we do have some PhDs on staff to help that. And we've been fortunate that customers have put our names on patents. Customer owns everything. They own the rights to everything. But it's fascinating that we've been so much part of developing these solutions that the customer's like, yeah, let's put their name on the patent.
Yeah, that's nice of them. And I want to ask you a little bit more about those customers. Like, what are some of the recent projects that you're most excited about, and the real world impact those are making or will make? I'd love if you could touch on, everyone, AI is all the buzz, right? Like any work you've been doing in AI or Gen AI, I would love for you to fill us in.
Yes, absolutely. One of those projects I referenced, when we first started talking, within the Indian Health Services now, we still run what's called the Joslin Vision Network Diabetic Retinopathy program.
Okay.
And we have about 100 cameras deployed throughout the U.S. to take photos of the retina, or the back of your eye, for detection of diabetic retinopathy. It's the leading cause of preventable blindness. If we find it, then it is treatable. Those readings historically, the images historically have been read by humans, individual people, which takes time. And so we have a couple different AI initiatives ongoing where the AI can look at those images and identify issues to make that reading process easier and faster. And what's fascinating about that, because if anybody is familiar with the world of diabetic retinopathy, they might say, hey, back in 2017, the FDA approved some of those early machine learning AI algorithms in diabetic retinopathy. Why aren't you using those? One of the challenges in AI, and particularly with images, as the technology improves and changes, those older machine learning algorithms don't work anymore. They were trained on a specific type of image. And so now as the camera technology, and we're using more advanced camera technology, we need to train new machine learning algorithms. So we've done a lot of early good testing with those. We, as part of this program, we have access to a lot of images to be able to train the system, so that it is awesome that we can make a difference there in the lives of a lot of people here in the States. One of the other projects, which I'm really excited about, we just got a SBIR grant, a Small Business Innovative Research grant from the NIH, with the idea of creating a domain-specific research repository for smell test data or olfactory data. The idea of testing the loss of the sense of smell or sensitivity has been around for a long time, but it didn't get a lot of funding, a lot of attention until COVID happened. And then everybody started losing their sense of smell. So now there's a lot of attention and focus on this. And a domain-specific repository hasn't existed yet. So we're going to create that. Part of the Healthy People 2030 goal, this is an initiative by the U.S. government to advance medical care, is to increase the use of smell testing. Because as research has discovered, there are potential links to over 100 different conditions. That decline or loss of smell might be an indicator of Parkinson's or Alzheimer's. So there's a lot of information you could learn from it. And as I got involved in this, you think, okay, your sense of smell, you don't really think about it that much,
Right.
But if you lose your sense of smell, that's significantly going to impact your ability to taste food, because a lot of tasting food is smelling it.
Yep.
But think about, if you're sitting at home and you're cooking dinner, you're in a different room, all of a sudden, whatever you're cooking catches on fire. How, before the smoke alarms start going off, you might smell that. And so as an early indicator of, hey, something's wrong, you burn your toast in the morning, you're going to smell that all throughout the day. If you can't smell, you're losing valuable time there in that picture. So it does have an impact on day to day in the world.
Yeah.
And beyond just creating this research data repository, one of the things is we're going to add the ability to perform what I'm starting to call conversational analytics. So instead of writing SQL or writing programs in R or SAS to really do that statistical analysis of the data and search for those correlations, and that you can just talk to the data. So just as you're talking with ChatGPT to generate your marketing information, or the next letter to your lawyer that you might have to write, now you can talk to your data. So
Yeah.
it's a powerful opportunity now to let a much wider group of individuals that might not be familiar with statistics to start looking at this data and pick it apart.
Yeah. I'm curious, what are the partners in that picture? Like, who ends up like providing that data and using the data, for olfaction,
Yeah, so as part of this grant, we're working with the Monell Chemical Senses Center, so big international institution that's years, decades of doing research in the space, as well as another organization called HealthTech2Care Health. They have a smell test that was developed by Monell. HealthTech2Care is going to commercialize it. And then as part of that grant, we're working with a large number of individuals that do this type of research that have said they're willing to share their data into this repository because they're going to get value of having access to other data. And as part of doing NIH research these days, you do have to publish your data out into the world. And so there are general repositories for this now, but it's really hard to use those across studies.
Yeah.
Where we'll have something really focused on the domain of olfactory testing.
Yeah, that seems to be the trend with like, if you want to build, like you were saying, conversational analytics, that you get to talk to the data, but anything that's like on top of a data set, like AI, conversational analytics, has to be domain specific. It needs to be standardized to the domain you're looking at, because otherwise the results just aren't good from what I understand at a very high level. I know that's probably a lot more bird's eye than you're into nowadays, but it's very fascinating to hear like the types of unique projects you guys are doing with diabetic retinopathy. Retinopathy. That's a word ball,
Yeah, try spelling that 3 times fast, and then ophthalmology.
Yeah. Ophthalmology.
In other words, I just every time I spell it, it's like spell check.
But no, it's fascinating to see the work. When you said earlier, I like to solve problems. Like it's clear, based on the projects you guys are doing, and so for those teams that are like sitting out there on valuable data, they're planning their next like digital product or go to market, solution. Where should they get started? Like where should they get started if they're sitting on data planning their next project? Is it like you mentioned earlier, a software development process of really like planning out like, okay, you're here, you want to get to this end goal. These are all the steps involved. Like how do they get started on that journey?
Yeah. So many thoughts come to mind. Sort of 2 things. One from I'll say a data project or a software project. One, it really does start with the data. As we talk to potential customers and current customers about new projects, AI is usually the first part of these conversations these days. And it quickly becomes a conversation around data. It's like, okay, what data do you have available? How are you going to access this data? Creating the good governance processes around that. Again, it's so much of this is about the people and the process, not just the data. Cybersecurity, risk management. You want to start a project with these things in mind because they're very hard to bolt on afterwards. Good cybersecurity if you're not starting with it. So definitely consider cybersecurity. In the world of healthcare, if you are creating a product or a company, you're a startup that you're going out into the world, healthcare is challenging. You need to understand the mechanics of the industry and the payment models. If you're creating something for a digital health app for a patient, who's paying for that? Who's prescribing or telling the patient about this and helping, supporting them? Who's benefiting from it? And so you have this triangle of like the medical professionals, the doctors, the nurses, the psychologists, the insurance companies, and then the patient. So, the doctor might be prescribing the digital health app to a patient, but then the insurance company is paying for it. So where are those incentives for making that all happen? It's challenging.
Wow. So you help like companies think through that, not just like the whole data software development, but also what are the incentives, around this and, what are the mechanics, like you called it? You really help them understand all that.
Yes. Yeah. My day-to-day is from a business development perspective is very interesting because some days I'll be working with large Fortune 50 medical device companies that truly understand this. And it's more about people and process and navigating, the corporation, and then I'll have a conversation with a startup, and they're like, go, 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 go.
Yeah.
Like, hold on a minute. There's a reason. There's a process involved in this, but
I love that.
Both are exciting from different perspectives.
Yeah. I love that. Go, go, go when you're a startup, and then like a huge Fortune 500 company or medical device company is looking at how do I navigate the sea of it's in front of me. And so for the teams listening, and thinking, this is the type of partner, like I like RJ and his team, like I want to explore something with this Estenda. How do they connect with you and your team online?
Yeah, our website obviously is a good place, estend.com, ESTEND. LinkedIn, absolutely. Follow us there. We're always posting and trying to get good content out into the world, and always thinking about how do we help others. It's sharing the information that we're learning along the way. Always good. From a personal perspective, I'm actually working on my first book, which is always interesting. So you can follow me either there on LinkedIn, posting about that, or on Instagram, Productive Harmony. But it's a book all about thinking, how do you be productive in today's world of information and technology? It's about energy management, not time management, which is just a fascinating subject. So later this year, that'll be coming out.
Yeah, I love that. We might have to have another podcast just on your book when it's released, and we'll have to do a debrief on, because that's something I actually appreciate is and try to like consider that in my day-to-day is how am I managing my energy. It's not so much time, because I think we're all busy with time, right? Like all of us have calendars filled with meetings and team meetings, client meetings, all the above. And it's like part of it is like, how do you manage your time? Like not the time, actually your energy is what I meant. Like, ensuring that's allocated, because that's what drives your body, your brain at the end of the day. Because time is relative, we can get philosophical, but like energy is what really drives us, as humans. So
it is. There's only 24 hours in a day. You can't do anything about that. So it's how you use that energy to maximize your productivity and avoid burnout as well.
Yeah, I love that. All right, we'll have to have a conversation on that when the book is for. Can we get a sneak peek on when the potential release date is, or to be announced?
TBD, but end of this year is
end of this year. So, nice. Yeah. Okay. All right. We'll definitely stay in touch on that. Yeah, RJ, it was a pleasure having you on the podcast today. You're leading some really interesting work across like global healthcare companies, digital health. It's clear you really dig into complex problems, and excited to keep tabs on your guys' journey at Estenda. And thanks for being a great guest and for the conversation today. Thank you.